Okay, so before this video started, I already washed my hands. I matched my patient's armband for her name and date of birth to make sure I had the right patient here with me. And then I also secured a private area to begin the self-assessment video. So with that being said, let's begin. Hi, my name is Natalie. I'll be your nurse today for the completion of this self-assessment video. Do you have any questions before we get started?
I do not.
Perfect. Can you name your, say your name for me?
Caroline,
And how old are you?
19,
Good. And what month is it?
December,
Perfect. And where are you right now?
an apartment.
Perfect. So my patient is alert and oriented ×3 to person, place, and time. Upon general survey, she has a good affect that is matched and appropriate for the situation that we're in. She is in a sitting position with good posture. She is well groomed, and her clothing is appropriate for this time and place. Although I'm not going to do this in the video, it should be noted that the vital signs of blood pressure, respiratory rate, temperature, and heart rate should all be taken and assessed for this video. And now we're going to start with assessing the skin. So right now I'm looking for any bruising, lesions, abnormal masses. Tell me if you have any pain or tenderness anywhere, while also assessing hair distribution, the texture, the color. So her skin is warm to touch. It's a pale coloring. There's no abnormal lesions, masses, bruising, anything of that sort. Her hair is evenly distributed. And now I'm going to assess her nails. She has good turgor pressure. Perfect, good capillary refill. She has no clubbing, so her degrees for her nail profile are less than 180. Next, I'm going to assess her head and her face. Again, I'm assessing for any masses, lesions, things of that sort, while also assessing her hair and her hair distribution and the shape of her head. So her hair is smooth in consistency. It's brown. It is well and evenly distributed and fully distributed. She has normocephalic, and she has no lesions or bumps or masses or any of that sort. Upon inspection of her face, it appears to be symmetric bilaterally. Her eyebrows, eyes, ears, and lips are all symmetric, as well as her nose. Then we're also going to now assess the temporomandibular joint for pain and crepitus and things of the sort. So what I'm going to do is place my hands right here on the joint. Can you open your mouth for me? Good, and close. And stick your jaw out and back. Perfect. So she has full range of motion. Did any of those motions hurt?
No.
Good. And she experienced no pain or tenderness upon those exercises. Next, I'm going to assess cranial nerve 5 through light sensory touch. And for this, I'm going to use a cotton swab test. So that I'm going to touch you with this cotton swab. And basically what's going to happen is I'm going to ask her to close her eyes real fast, and I'm going to ask her to say now when she feels it.
No.
Perfect. Now to complete cranial nerve 5, I'm going to ask you to open your mouth and smile and clench your teeth. Perfect. Now I'm going to assess cranial nerve 7. So I'm going to ask her to complete a series of motions. Can you squeeze your eyes really tight? Raise your eyebrows. Make a frowny face. Good. Puff out your cheeks. Good. And stick out your tongue. Perfect. So this proves that cranial nerve 7 is in fact intact. Next, I'm going to inspect her nose. So her nares upon inspection are symmetrical. I'm going to then assess nasal patency. So I'm going to have you close one nostril. Breathe in. Breathe out. Good. And now the other nostril. Breathe in. Breathe out. Good. And her patency is good. I'm now going to use my otoscope to look into the nares at the turbinates and as well as the nasal mucosa and the nasal septum. So I'm going to tilt her head back and look in. Good. Good. So there are no exudates or polyps or swelling on her turbinates. Her nasal mucosa is that bright cherry red, which is as expected, and her nasal septum is not deviated. Next, I am going to inspect the eyes. Her eyebrows, eyelids, and her actual physical eyes are all symmetrical. Close your eyes for me. Her eyelid, you can open. Her eyelids, her top eyelids fully articulate with the bottom. Her eyelashes appear to be evenly distributed and are curved up and outward. Now, upon inspection, her sclera is that china white. Her iris is round and flat in an even brown color and fully circular. And her conjunctiva is clear. Next, we're going to do the Rosenbaum test to test her near vision. So what I'm going to have you do is hold this test view. It should be about 14 inches from her face. And I want you to cover one eye, whichever one you want to start with, and read the smallest line for you.
GCBXU.
Perfect. And now the other eye.
GCBXU.
Perfect. And then both eyes at once.
GCBXU.
Perfect. And now according to the Rosenbaum test, she does have 20/20 near vision. Next, what I'm going to have her do is follow and test cranial nerves 3, 4, and 6. So I'm going to ask you to look at my finger and follow it without moving your head. Perfect. And since she was able to follow my finger into all 6 cardinal points, I can say that cranial nerves 3, 4, and 6 are in fact intact. Next, I'm going to look at her pupils, and now I have a gauge here for the size of the pupils. And I can say that they are the same size bilaterally. Her pupils are round and dark. And then now I'm going to test the reactivity to light. So what's going to happen is I'm going to ask you to look past me, and I'm going to shine a light into her eye. And normal finding would be that they contract when the light comes into the visual field. Perfect. Now what I'm going to do is ask you to put your hand straight in front of you. Perfect. This is to create almost a barrier. And right now what I'm checking is I'm going to shine a light in this left eye and checking for contraction in her right, and then I will flip. The normal finding is that when I shine the light in this eye, the other pupil will contract, and that is what I saw. Finally, I'm going to use an ophthalmoscope, and what I'm going to do is I'm going to test her red light reflex as well as look at the back of her eye. So I'm going to start in her left eye. Perfect. Now her right eye. Perfect. And her red light reflex is in fact intact. And for the back, there are vessels present in all 4 quadrants. Her optic disc is that orangey yellow, and it's circular, and it has very distinct margins. And her retinal background in general is that light red color, as should be expected. Next, I'm going to assess her ears. First, what I'm going to do is see that they are symmetric. Then I'm going to palpate around in inner ears for any masses, lumps, and also tenderness. So let me know if any of this feels tender to you. Tenderness? No. Okay, perfect. So now what I'm going to do is actually take my otoscope again, and I'm going to look actually in her ear at the ear canal. And here I'm looking for any masses, lesions, abnormal discharge, swelling, any of the sort. And I'm also inspecting her tympanic membrane. And so upon inspection, there's no lesions, discharge, abnormal masses, anything like that. Her tympanic membrane is that pearly gray, and I also inspected the cone of light when I was using my ophthalmoscope, which was at the 5 o'clock position in her right ear and the 7 o'clock position in her left ear. Now I'm going to assess cranial nerve 8 and do the whispered voice test, so I'm going to have you pivot this way. So what's going to happen is I'm going to get behind her, I'm going to whisper 3 words in your ear, and I'm going to have you repeat them after me.
Bed, clothes, bear.
Perfect. Now I'm going to come around the other side and do the same thing.
Pillow, hand, ben.
Perfect. So now, since she completed, she could hear and repeat those words back to me, we can assume that her cranial nerve 8 is in fact intact. The next thing I'm going to assess is her mouth and her pharynx area. So upon inspection, her lips are pink, even color. There's no cracking. They appear to be smooth and well hydrated. Her teeth, smile for me, are white and evenly distributed. Her gums appear to be pink and smooth with no lesions. Now I'm going to have you open your mouth for me. Good. And I'm going to use a tongue depressor here to look at her buccal mucosa. Good. And it appears to be pink, shiny, well hydrated, also no lesions. Now I'm going to have her open up again. I'm going to tilt her head backwards to look. You can keep your tongue in. I'm going to look at her hard and soft palate. Her hard palate appears to have ridges and is a whitish color, whereas her soft palate is a pinkish and smooth, and it also is able to be pressed upward. Finally, you can stick your tongue out for me. Good. And I'm going to use a tongue depressor again. Say ah for me. Good. And the uvula arises at the midline. Finally, I'm going to use my tongue depressor again to assess her gag reflex, which shows cranial nerves as well. So here we go. Perfect. And her gag reflex is therefore intact. Next, what I'm going to do is just a sequence of tongue movements. So can you move your tongue, stick your tongue out for me, and move it from side to side. Good. Now push your tongue against your cheek and the other cheek. Good. And now this one again, and push against my finger. And push again. Perfect. So since you could complete all these tongue movements, and now say light, tight, dynamite for me.
Light, tight, dynamite.
Perfect. Since you can do all of those things, we can say cranial nerves 9, 10, and 12 are all intact. Next, what we're going to do is neck movements. So touch your chin to your chest, and the back of your head to the back of your back. Good. Your ear to your shoulder, your other ear to your shoulder. Perfect. And now pivot your head for me. Right, look left. Perfect. Now what's going to happen is don't put pressure against my hand. Don't let me push it over. Good. And now this way push, in the front push, and in the back push. Perfect. So we can say she has full range of motion in her neck, and her muscle strength can be rated a 5. Now what's going to happen is I'm going to ask you to lift your shoulders, shrug them up for me. Good, and down. And now don't let me push your shoulders down. Very good. So now that tests muscle strength again, which can be rated a 5, and also proves that cranial nerve 11 is intact. Next, what we're going to do is palpate the trachea. So I'm going to come along here. Good. I'm palpating the trachea, and then I'm going to move it right and left bilaterally, making sure it has symmetric movement. Next, after that, I'm going to palpate the thyroid. So I'm going to ask you to turn this way here. I'm going to use the posterior approach and come back. So I'm going to have you put your left ear to your left thing, and I'm going to push her trachea over and palpate. Good, and now lean right. I'm going to push her trachea to the right and palpate. Good, and now straight up. And her thyroid gland is not palpable. Next, what I'm going to palpate for is her lymph nodes. So I'm going to come here, and she's going to tell me if she feels any tenderness. So I'm going to start with the preauricular, postauricular, occipital, submental, submandibular, tonsillar, and then this right here is the anterior cervical chain. I'm going to walk my hands down, and then in the back, the posterior cervical chain. So I'm going to walk my hands back. And did you feel any tenderness with any of those?
No, I did not.
Perfect. So that means her nodes there were freely movable, soft, and non-tender. Next, what I'm going to do is I'm going to have her neck at a 45-degree angle and look for any jugular distension. And although you can see a pulse in her jugular vein, there are not any abnormal swelling or distension that can be seen. Next, what I'm going to do is her anterior thorax. So what's going to happen is I'm first going to inspect it, step straight for me. Good. I can say her AP diameter is less than her transverse diameter, which is a good finding. Her skin is even and there's no lesions, and it's symmetric bilaterally. She doesn't appear to have any labored breathing as well. First, so now, and upon inspection, she has no heaves, trills, or anything like that. Now I'm also going to palpate, so I'm going to palpate her precordia. And again, I'm looking for any masses, lesions, tenderness of the sort, and I'm also feeling if I can feel any heaves, trills, or lifts, which I do not feel any of the such. Next, what I'm going to do is I'm going to assess her apical pulse, which is on her 5th intercostal nerve right here, and I'm going to match this with her carotid. Good. And I'm going to match it again. Perfect. And then these appear to be symmetric, and both have a 3+ pulse rating. Next, what I'm going to do is heart sounds. So I'm going to start, and I'm going to start with my diaphragm, and then after I complete the 4 spots, I'm going to move to the bell. So I'm going to start here with the aortic, good, the pulmonic, good, perfect, and then the mitral. Perfect, and now I'm going to use the bell again, and I'm going to flip it over, I'm going to use the bell for the mitral, and the pulmonic, and the aortic, and then this one is the tricuspid. Perfect. Now that I assessed her heart sounds, and they all appear to be regular, in that lub-dub format, I'm now going to assess her lungs. So I'm going to use the diaphragm to assess her lungs, looking for any adventitious sounds or anything like that. So I'm going to ask her to breathe in, good, and out, breathe in, out, perfect, and then we're going to work our way down from there. And you let me know if you have any dizziness or anything, and we can slow down. Perfect. And she has clear, distinct sounds with no adventitious sounds able to be recorded. So now I'm going to have you turn this way, and we're going to look at the posterior thorax. Again, we're going to start with inspection, so lesions, bruising, scarring, things of the sort. Also look at tenderness. Her AP diameter, again, is less than the transverse diameter. Her respiratory effort does not appear to be labored. And now what we're going to do is percuss on the back. And work our way down. Good. And these are resonant sounds, which are what you'd expect to find. And then we're going to test for CVA tenderness. So that's going to be at the costal-vertebral angle. So I'm going to just pound here and pound here. Do you experience any tenderness there? Perfect. So that is a normal finding as well. Lastly, we're going to look for respiratory excursion. So I'm going to put my thumbs here and about 2 inches apart. And ask you to breathe in and breathe out. Perfect. And so my thumbs expanded and the diaphragm expanded bilaterally and symmetrically. Now we are going to listen to the lung sounds. And so, again, you can breathe in for me. Out, in, out, in, out, in, and last 2. And again, I'm using my diaphragm for this part of the evaluation. Perfect. And again, I was clear sounds with no adventitious sounds being heard. So now what I'm going to do is I'm going to have you lay down and we're going to inspect the abdomen. Perfect. And just a clarification, the heart and lung sounds should be taken with the stethoscope straight onto the body, but for the purpose of this video and for my patient's decency, I decided to do it over the clothing, which can produce almost abnormal findings. So upon inspection, her abdomen is flat and smooth. Her umbilicus is in this midline and it's inverted. She has, you can see her pulse and respiratory movements. Actually, they're very strong at this moment. And first what we're going to do is start by listening. So I'm going to use the bell to listen for vowel sounds. I'm going to use the bell portion of my stethoscope, and I'm going to start in the right lower quadrant. And I'm going to move to all 4 quadrants, listening for vowel movement sounds. So an abnormal finding would be silence in this case, but that is not the case. So I did hear vowel sounds in all 4 quadrants, which those consist of clicking or gurgling or things of that nature. Next, what's going to happen is I'm going to palpate. I'm going to start with light palpation, which is a very soft touch. Here I'm looking for tenderness or stoppage of my hand for something to hit. Perfect. And once I don't feel that, now I'm going to start with deeper palpation here. So this is a lot deeper. So this is 2 to 3 inches, maybe more. And again, I'm looking for tenderness as well as feeling stoppage of my hands. Perfect. Now that I've palpated the whole stomach, I'm going to palpate for specific organs. So I'm going to start in the right upper quadrant, and I'm going to start by palpating the liver. So what's going to happen, I'm going to put my hand underneath her. I'm going to feel for the rib cage here and use the hooking method. I'm going to ask you to breathe in, and I'm going to push my hands together until I feel the mass. Good, and breathe out. Perfect. So I can palpate the liver here. Next, I'm going to come to the other side, or I'm going to just reach over in this case. Typically, I would get on the other side of the bed. And I'm going to palpate for the spleen. So I'm going to put my hand in again. And again, I'm going to walk it up. Breathe in. And palpate, and breathe out. So the spleen is actually not palpable in this case. Next, I'm going to palpate for both the kidneys. So again, I'm going to put my hand underneath. I'm going to feel here. Breathe in. Push. I'm pushing my 2 fingertips together. Really pushing hard. Good. That kidney, her right kidney, is not palpable. And now I'm going to go for the left kidney. Breathe in. And breathe out. Perfect. And that one is not palpable either. Next, what I'm going to do is I'm going to percuss in all 4 quadrants. So I'm going to come here. Good. So you could hear the timpani in all 4 quadrants. Now I'm going to see the distribution and the outline of the liver in the right upper quadrant. So what's going to happen is the sounds are going to go from timpani to dole. And that's how I'll find where the liver is. And as you can see, this is the border of the liver right now. Next, what I'm going to do is check the vasculature. As said before, I talked about the jugular distension, and I talked about the capillary refill in her nails, so that showed the peripheral vasculature there. But I am now still going to check and palpate the different pulsations. So what I'm going to do is I'm going to start here, and I'm going to make sure that they're symmetric bilaterally. So I'm going to start with the brachial pulse. Good. I'm going to have her flip her arm over and do the radial pulse. Perfect. I'm going to assess the 2 carotid pulses. Perfect. I'm going to assess her femoral pulse, which is in the groin area. Good. And now I'm going to assess her medial tibialis, which is on the medial side. Behind her heel. Good. And now the dorsalis pedis, which is after right lateral to the first ray after her big toe. Which I feel. Perfect. And lastly, I'm going to assess her popliteal. So I'm going to first bend her knees a little. And I'm going to feel it here in the back. Perfect. You can put your legs back down. So they are all present. The pulses are all 3+, and they're bilaterally symmetric. Yes. Now what I'm going to do is listen to these different areas for bruits. So I'm going to use the bell of my stethoscope. And I'm going to start with the carotid in the neck. I'm looking for the bruit on both sides. Looking for any sounds. Perfect. And then I'm going to do the femoral. Move your hands real quick. Perfect. Good. Now I'm going to do her renal, which is 2 up and 2 over from her umbilicus. So 2 up, 2 over. Perfect. And I'm going to do that bilaterally on both sides. Good. And now I'm going to do her aorta, which is lateral to the umbilicus. And I'm going to do her iliac, which is 2 fingertips down and laterally on both sides from her umbilicus. Perfect. And she had no bruits upon detection. So now what I'm going to do is I'm going to have you sit back up real fast, and we're going to do the neuro examination. So what I'm going to do first is I'm going to start with cerebellar functioning, and it's going to be the rapid alternating movement test that we use first. So I'm going to have you place your hands on your legs, and I'm going to have you supinate and pronate them as fast as you can. So you can begin now. Perfect, and you can stop. So this proves 1 point of cerebellar functioning. The other one, I'm going to have you touch your finger to your nose right now. Good, and now to my finger. And now back to your nose, and match it back to my finger. Good, and do it as fast as you can. Perfect, so this also proves cerebellar functioning. The next thing we're going to do is the light sensory touch. And this is very similar to the test we did before with the cotton swab, but now we're going to be using a Q-tip. So you're going to feel light touch on different parts of your body, and I want you to tell me when you feel it. So you can close your eyes. Perfect. So she was able to complete those things, which proves good functioning. Next thing we're going to do is the reflexes. So first, what I'm going to do is I'm going to have the brachial under her arm. And so what's going to happen is her elbow is going to extend up. Perfect. I'm going to do it on the other arm as well to match it. Good. And her reflexes match symmetrically, and they're both 2, rated a 2. Next, what we're going to do is we're going to do her brachial radialis, which is right here. And this will show flexion of the wrist. And then flexion of the wrist. Perfect. After this, what we're going to do is the triceps. So I'm going to lift your arm so you can really relax it. And I'm going to hit right here on the triceps. And her elbow's going to go out. Perfect. And her arm's going to extend. I'm going to do this on both arms. Up. And her elbow is going to extend. Okay, perfect. Next thing we're going to do is, it's going to be the patellar. So I'm going to have you sit back a little bit more. Scoot back. Perfect. I'm going to have you really relax your leg here. I'm going to feel for the groove. I'm going to hit here. And her leg's going to extend. Good. And on the other leg. Good. And these reflexes are all normal. The last one I'm going to do is the ankle reflex. So what's going to happen, I'm going to dorsiflex her foot. So I'm going to push it upward. I'm going to hit her Achilles. And what should happen is her foot should go and extend down, or plantar flex. Perfect. And now on the other foot, I'm going to lift it up to dorsiflex and hit the Achilles. And good. The reflex goes down. Okay, the next thing I'm going to do is the Romberg test. So I'm going to assess, can you stand up for me? Good, feet together, arms by your side. Good, and now close your eyes when you do it. Good, so this test should take about 20 seconds. I'm looking for any swaying or abnormal movements or the ability to not perform this exercise. You can open your eyes. So there were no abnormal findings here, which means the Romberg test was negative or good. Next thing I'm going to do is I'm going to assess the gait. So I'm going to have you walk to the computer and back. Walk to the computer and then stay there. So I'm assessing his gait. There's no extra movements, no lack of imbalance. It shows good coordination. Now I'm going to have you walk back to me, and I want you to do it heel to toe. So put one heel touching your toe and walk back to me. Good. Again, this shows good coordination, good functioning. She has good ability motorly. So this would be graded normally. So now what I'm going to do, put your hands out of your pockets. I'm going to have you face this way. Good. And bend down to the camera, and I'm going to assess her spine and her scapula. So upon assessment, her spine is that S-curve shape. Her scapula are symmetric bilaterally. Stand up for me. Okay, good. Now I want you to bend your back as far back as you can. I want you to bend to one side. Good. Now the other side. And do a full twist. Perfect. So she has full range of motion in this. Next, what's going to happen is we're going to test the shoulder actively first and then passively. So I want you to go up and then down and then out to the side and then do circumduction. Good. Do internal rotation and external rotation. Up. Perfect. So that was active motion, and now we're going to do the same thing with both arms passively. So I'm going to go all the way up, all the way down, all the way out. Circumduction, internal rotation, and external rotation. Now we're going to assess, so she had full range of motion in that. Now we're going to assess muscle strength. So put your arms out like this. Don't let me push them down. Don't let me push them up. Don't let me push them to the side. Don't let me push them to the side. Okay, perfect. So her muscle strength would be rated, you can put your arms down. Her muscle strength would be rated a 5 in this show. And also her joints show no crepitus during these motions. Next, what I'm going to have you do is flex and extend your elbows for me. Perfect. That was her active motion. Now I'm going to do the same passively. Let me do it for you. Good. There's no crepitus, or is there any pain that you're experiencing during this?
No.
Perfect. So now what's going to happen is I want you to supinate your arms and pronate them. And now I'm going to do the same things for you. Good. And now put your wrists straight up like this. Don't let me push them back. Don't let me push them forward. Stick your fingers out. Don't let me push them together. Good. Put them together. Don't let me pull them apart. Perfect. So this shows also the muscle strength, which could all be rated a 5. You can put your hands down now. Finally, what we're going to do is a knee bend. So I want you to flex your knee like this, and now flex the other knee. Perfect. Now I'm going to do the same thing passively. So I'm going to flex this knee for her. Up and down, and up and down. Perfect. So she had good full range of motion, both active and passively. Now I'm going to test her muscle strength of her knee. So what's going to happen, don't let me push this up. Good. Now flex your knee for me, and don't let me push it down. Good. Now I'm going to do the same thing. Don't let me push, don't let me extend it, or push it up, flex it. Good. And now flex it for me, and don't let me put it back to extension. Good. So she had muscle strength again, which could be rated a 5. Now I'm going to have you sit down again. And what's going to happen, I'm going to have you dorsiflex, so put up your toes, down your toes, don't turn your toes out, and back in. Okay, perfect. So now that was her active motion. Now I'm going to do the same thing passively. Perfect. And now I'm going to put resistance. So put your toes up for a second. Don't let me push them down. Don't let me push them up. Good. Don't let me push them out. Good. And don't let me push them in. Perfect. So then she also had muscle strength rated a 5 in this thing. Then lastly, what I'm going to do, I'm going to have you lay down for me. And now I'm going to have you put this way, lift the leg all the way up, and back down, and your other leg, all the way up, and back down. Good, now bring this knee to your chest, all the way up, back down. Good, and now this knee. Good, and now we're going to extend in and out, so put this knee up again, put it out, and back in, and down, and this knee up, out, and in. Perfect, like that. Now I'm going to assess it actively. So I'm going to do it up, down, put our knee up, over, and out. Good. And I'm going to do the same thing. Up, down, up, out, and over. Good. So now I want you to lift this leg up for me. Good. Don't let me push it down. Don't let me push it up. Don't let me push it out. Don't let me push it in. Good. Other leg. Don't let me push it up. Don't let me push it out. Down, sorry. Out, and in. Good. Now put your, put this knee to your chest. Don't let me push it down. Don't let me push it up. Good. Don't let me push it out. Don't let me push it in. Good. Now this one, knee to your chest. Don't let me push it up. Don't let me push it down. Don't let me push it out. Or sorry, in. And don't let me push it out. So again, she had full range of motion in her hips and her knees, both actively and passively, and her muscle strength was a 5. And given that, we are now done. Thanks for watching.